Mumps it is one of the communicable disease and it's a acute contagious disease characterized by infections in the parotid gland. The main causative organism is myxovirus parotiditis. The main etiology of this condition is mumps is endemic in most unvaccinated population. If the patient does not take MMR vaccine, that population mumps is very common. It occurs in most commonly between 5 to 15 years of age. Males are more vulnerable to this mumps and common in winter season and overcrowding also spread this disease. The virus can spread by direct contact, airborne droplet, formates contaminated by saliva, and possibly by urine. So, it's a very contagious disease and it passes by contact or droplet infection. It affects both sex equally, but male predominance is there. The main symptoms of mumps it include headache, pain in joints, fever, swollen parotid gland, loss of appetite and nausea, a dry mouth, and parotid gland enlargement may occur. Usually, the swelling will be subside within 7 to 10 days. The diagnosis of mumps it is done by history assessment, physical examination, then laboratory examination. So in the laboratory here we can isolate the virus from saliva, urine or blood. The main complications that may occur in mumps is hearing loss, encephalitis, pancreatitis, meningitis, otitis, oophoриtis. So the most common complication that's seen in mumps is orchitis. 20 to 45 percentage of persons have orchitis, development of orchitis, and this orchitis may leads to impotency or infertility in male child. The main management of mumps, actually it's a viral disease. There is no specific antibiotic for mumps and it is a self-resolving disease and the bed rest, plenty of fluids, then symptomatic treatment. It includes paracetamol to reduce pain and fever, cold compress that against cold compress can use for swollen parotid gland, soft and easy food such as soup, porridge, and vegetables, then isolation to reduce the risk of spread of disease. Prevention of mumps. Patients should stay away from others for minimum 5 days from onset of symptoms. The main incubation period of mumps is 2 to 3 weeks, usually 18 days. So, during these days, if the patient is in isolation, there is less chance to get this disease. Then encourage patient for good hand washing practices. This disease can be spread by contact. So that's why the patient should thoroughly hand wash. Then encourage the patient to cover mouth during coughing and sneezing. This disease can be transmitted by droplet nuclei. So droplet infection. So the person should cover his mouth while sneezing and coughing. Then drinks and eating utensils of patient should not be shared with others. The patient should be in isolation and his all articles should be in isolation. Then frequently touched surfaces should be kept clean. So the high disinfectant can be used to prevent the spread of disease. Then another method of prevention of mumps is MMR vaccine. MMR vaccine is a live vaccine. Here we are preventing measles, mumps, rubella. The main schedule or when we are giving this injection is in 16 to 24 months. That is the first dose, and second dose we can give in 4 to 6 years of age. The dose is zero point 0.5 ml and it is given in subcutaneous, and usually we are giving in right arm. The main contraindication of MMR vaccine is immunosuppressive therapy, corticosteroid therapy, then malignancy, untreated TB. In these conditions, we are not giving MMR vaccine. The storage of this MMR vaccine is 2 to 8 degrees Celsius and it is very sensitive to heat and light.